Hello, the patient I will be presenting today um, is a patient who came in with the chief complaint that my right foot is still hurting really bad. The patient is a 57-year-old Hispanic male who presents with diabetic foot wound on right heel. The patient would last visit was 3 months ago, and it was a little bit of pain, but it was only 2 out of 10. No sore or blister was present. The patient was diagnosed with type 2 diabetes about 30 years ago. He's alert and oriented times 4. Patient is also compliant with his medications. The patient's medical history: no past hospitalizations. He has type 2 diabetes and hypertension. No known allergies. The medications he's taking is metformin 1,000 milligrams. He takes that twice daily. And losartan 50 milligrams. He takes that once daily. Patient lives alone. He works as a construction worker. He has 4 children, and he denies alcohol and illicit drug use. His mother had diabetes and hypertension. She's deceased. And his father had diabetes. He's not sure if he had any kind of hypertension or not, but he's deceased too. The patient got his flu vaccine back in November. He declined the COVID vaccine, and his unknown tetanus, he don't know that he had that or not. And he usually follows the healthy heart diet. For the range of symptoms, the patient denies chills, fevers, night sweats. He denies headache, vision changes, hearing loss, doesn't have any stiffness or pain in neck, denies chest pain, denies coughing, shortness of breath, no abdominal pain, no urination difficulties, no swelling or muscle pain. But he does have a small closed blister on his right heel. No tingling or numbness, denies depression. No bleeding, no bruising, no allergies. Heart rate is 76, respiratory 17, blood pressure 130/80, temperature 98.6, pulse ox 100%. He's 5'9", weighs 215 pounds. And now he says his pain is 7 out of 10, but it goes up higher if he walks more. On the physical exam, everything was pretty normal except for the heel of his foot, which is, it hasn't gotten any bigger than it was last time. It's just forming a blister on his right heel. The diagnosis is diabetic foot. The plan of care is I did a blood, well, he did the MA did a blood glucose, and it was 98. Then we looked at his A1C, which was 6.5, which is okay from last time. So my preceptor said that he was going to prescribe cephalexin 500 every 12 hours for 7 days. Number 14, no refills. Then he's going to refer him to a podiatrist to have the specialist look at it more, because that's a specialty. Just so the patient could be covered with that. We educated the patient on to inspect his foot daily for new injuries. Don't walk around barefoot, because his feet may not have as much sensation in it, and it calls for injuries. Keep the feet moisturized and make sure it's dry, not wet. Make sure he's checking his blood sugar daily. And to the follow-up, just to make sure that he makes his appointment with the foot doctor, and to come back to see him if he doesn't see any kind of improvements. Also told, make sure the patient knew to make sure he take care of his feet. Keep his toenails trimmed and things like that to help to, keep down the risk for infection or things that could happen to his feet.